Hey guys, it's Don with Abundant Life. This video is going to talk a little bit about controlled medications and counting and documenting them. So for those of you who did paper notes with us, you're probably used to seeing this form, which was our controlled medication count. It would have the name, the medication, the dose, and the month and year, and you would initial and then write the count when you came on the shift and when you left. So we've incorporated that into ERSP as part of our initiative to go paperless. So I'm logged in as our test nurse, Nurse John Doe. So we're going to go to my calendar, and we're going to go to a visit today for demo patient. Now, the first thing you'll notice on this patient is that under the direction section in the visit details, there are two fairly large notices. And you'll see the first one says medications and treatments must be documented during shift. This is a policy update, and you can see a video related to that for medications, and that will explain all of that. But this video is talking about controlled medications. So for all of our controlled medications, they will be listed in the directions section for each patient. This particular patient has diazepam, Diastat, yes, we have to count those, and Vicodin. So you'll see in every patient all the medications that need to be counted are right here in the visit details section. Okay, so moving on, so you'll come on shift, and if you're not relieving a nurse, then you can perform the count with a parent or family member. And pay attention to these numbers here on the visit details, and they'll come in handy when we document them here in just a second. Okay, so in the MAR, you'll also see that the first medication for this patient is an alert to us that tells us that this patient has controlled medications. So if you see this, you'll know that you're supposed to be counting something. And then each medication that is controlled and needs to be counted is going to have a controlled medication notice right here in the information for the med. Okay? So we come on shift, we perform our count with the off-going nurse, and then we're going to document that here in the assessment. So here in the assessment, for medication 1, because remember, medication 1, right, was diazepam and Tensol, 5 milligrams per milliliter. So for medication 1, we're going to document that here. So diazepam and Tensol, 5 milligrams per milliliter. Okay? All right, so when you come on, the bottle has, let's say, 25 milliliter. Okay? So you would do that for each medication, to count when you come on. And of course, make sure to click update and save your work. So then as you document and come off, this patient here for a 12-hour shift would receive this medication twice. So you'll know already what your count will be when you leave. So when you do your count at the end of the shift with the next nurse, you would put that amount in there. So this would be 23 milliliters, right? And of course, click update. And that's that. You can also, of course, look at old, down here where the assessments would be. You can look at old assessments and see what the other nurses were counting. So if there's ever a discrepancy, of course, you want to call the office immediately, 727-286-8916. And if you have any questions, feel free to send us a message or give us a call. Thanks.